I'm a cardiac surgeon because at the end of the day, I wanted to help people, and I wanted to do so in a way that involved dealing with sick patients and being able to help them navigate some of the scariest moments of their lives. And because cardiac surgery is one of the most technically demanding surgeries that I could imagine.
And what does the actual training look like in terms of being able to operate on someone's heart? How do you go from deciding you want to be a cardiac surgeon to then performing that surgery?
You not only have to learn the medicine behind the physiology and the patients that you're taking care of, but you also have to learn the technical skills and being able to operate, being able to perform fine anastomoses or other procedures requires hours and hours of practice. Most of the time that practice happens under supervised conditions on real people. You're acutely aware at all times that this is someone's mother, father, sister, brother.
You literally have a life in your hands when you're performing a cardiac surgery. How do you deal with nerves and anxiety going into a procedure?
Being a good surgeon requires the ability to focus, and by that I mean to shut everything else out. You focus in and you drill down on that one patient, that one incision, that next step. And on the really complicated surgeries, you don't even think about the step after that one. You just think about what you're doing right now, and you devote 110% of your energy and your attention to it.
What type of exercises would you use to help kind of home in that focus and give 100%, 110% of your attention to that patient? Because building that kind of mental strength and resiliency isn't easy. How do you do it?
I don't know that I ever perform specific exercises to learn how to focus, but when you spend 12 or 18 hours a day in the operating room, every minute of every day is an exercise. When you're a student and you're learning how to do the very basics, it requires all of your attention. And the more you strengthen that muscle, the more you practice that act of focusing and being attentive, the easier it is later on.
What about dexterity? Is there anything that you do now and as you continue to progress in your surgical career to make sure that your skills stay sharp?
We sometimes try practicing sewing with our non-dominant hand, with our left hand. It's a really fascinating exercise because it not only trains your other hand to do things, but it also really messes with how your brain focuses on things, and it makes you stretch in ways that you wouldn't think of normally.
In sports, you can measure success by wins and losses. How do you measure success as a cardiac surgeon?
Exact same way, wins and losses. Patients who go home healthy, happy, and return to their normal lives win. Patients who don't make it home or who make it home with serious adverse events, loss.
How do you bounce back from that adversity so that it doesn't affect you next time you're in the operating room?
It's really, really hard, most of us, myself included, when something goes wrong. Spend a lot of time thinking about what we did, what we might have been able to do differently. What's really key in surgery is having a mentor or having someone that you can speak to and that you can run through the scenario, that you can debrief with.
Dr. Hale, thank you so much for your time today. It was an illuminating discussion. I learned a lot.
Thank you so much for having me.